Welcome to our deep dive. This time we're going exploring the world of German nursing homes,
Okay.
specifically how they assess the risk of decubitus ulcers.
Right.
We've got some blog posts that you sent over from Schwester Eva, German nursing expert.
Yeah.
And let me tell you, she does not mess around when it comes to bed sore prevention.
Yeah. It's clear that in German healthcare,
Yeah.
they take this issue so seriously.
Oh, yeah.
And Schwester Eva really emphasizes that early assessment is key.
Right.
Those first 8 hours
Oh.
after a patient is admitted are crucial.
Ah.
It's all about creating that baseline for preventative care.
Yeah, I was struck by that too. It's
Yeah.
like they're already thinking several steps ahead,
Right.
which makes sense. These ulcers can develop that quickly.
Yeah.
So what kind of assessments are they doing in those first 8 hours?
Well, they're looking at everything.
Okay.
A full head-to-toe skin inspection
Right.
to check for any existing issues, redness,
Okay.
pressure ulcers. They even have what they call a finger test
Oh, yeah.
to check for existing pressure ulcers.
Uh-huh.
And Schwester Eva points out that missing this initial assessment
Yeah.
or not documenting it properly could actually be considered a nursing error in Germany.
Wow, they really mean business.
Yeah.
It sounds like this sets the stage for a much more detailed assessment,
Exactly.
using a tool called the SS, or Structured Information Collection.
The SIS is like a deep dive into the patient's history.
Okay.
Think medical records, mobility limitations, medications,
Wow.
skin condition.
Yeah.
It paints a comprehensive picture of the individual.
I'm picturing it like a detective's notebook,
Yes,
gathering all the clues to understand the patient's vulnerabilities.
exactly.
And within this SIS, there's a risk matrix that helps flag potential problems,
You got it.
including bed sores.
But it's not just about checking boxes.
Right.
If the SIS points to a potential bed sore risk,
Uh-huh.
it triggers a much more in-depth assessment,
Wow.
which also needs to be thoroughly documented.
So it's like a multi-layered approach,
Yes.
starting broad and then getting really specific
Right.
if there are red flags.
Exactly.
This makes me think about Frau Gerda Bessler,
Yes.
the 78-year-old woman featured in one of Schwester Eva's blog posts.
Right.
She seems like the perfect example of how seemingly unrelated factors
Absolutely.
can combine to create a high risk for bed sores.
Frau Bessler has limited mobility from a previous hip fracture.
Okay.
She is also overweight
Uh-huh.
and sometimes struggles to get out of bed,
Right.
even for meals.
So right there, we're seeing several risk factors
Yes,
that might not be immediately obvious if you weren't taking this holistic approach.
exactly.
We've got the immobility,
Right.
but then the added pressure from her weight,
Yeah.
and potentially even nutritional concerns if she's not consistently getting up for meals.
And those are just the factors we can see at a glance.
Right.
Imagine the additional insights
Yeah.
they might glean from the SIS.
Oh.
And those detailed assessments.
It really highlights the importance of understanding the whole person,
Exactly.
not just one isolated issue.
Yeah.
And I'm starting to see how in the German system, that thorough assessment is the foundation for creating a really personalized care plan.
Yes.
What are some of the key risk factors that Schwester Eva highlights beyond just basic mobility?
Well, on top of the things we've already mentioned, skin condition is a big one.
Okay.
Existing sores, dryness, or poor circulation are all red flags.
Gotcha.
And here's one people might not immediately think of: sensory perception.
Oh, that's seriously, I hadn't considered that.
If a patient has reduced feeling in their skin,
Right.
they might not realize they need to shift their position to relieve pressure.
Makes sense.
And then you have things like medical conditions,
Yeah.
diabetes, for example,
Right.
that can hinder healing.
Mm-hmm.
Even nutrition and hydration are critical.
Okay.
Because if those are poor, the skin becomes much more vulnerable.
And of course, there's incontinence, which I imagine plays a huge role since moisture can really wreak havoc on the skin's integrity.
And it's not just about the presence of incontinence, but also how it's managed.
Right.
Prolonged exposure to moisture, whether it's urine or feces, can drastically increase the risk of bed sores.
So it's not just a single factor, but a complex web of considerations
Right.
that come together to paint a complete picture of the patient's risk.
And that's what makes the SIS and these thorough assessments so valuable.
Yeah.
They help to uncover those hidden risks
Uh-huh.
and tailor the care plan accordingly.
Speaking of care plans, I'm eager to learn more about the specifics.
Okay.
How do they take all this information gathered through the SIS and the assessments
Right.
and actually translate it into action?
Yeah.
What does a typical care plan look like in a German nursing home?
That's where the rubber really hits the road, and we'll dive into that in just a moment.
Okay, I need a moment to digest all this
Right.
before we jump into the specifics of those care plans. I'm already starting to see how German nursing homes approach this with a level of detail and proactive thinking.
Yeah.
It's pretty impressive.
It is. So we were talking about that initial 8-hour window and the SIS tool.
Right, and now I'm really curious to learn about the care plans
Yeah.
that come out of all that information.
Well, let's start with repositioning,
Okay.
which is a cornerstone of any good decubitus prevention plan.
Makes sense.
But as you might imagine, it's much more nuanced than simply turning a patient every few hours.
Right. I'm guessing that's where Frau Bessler's case becomes really instructive.
Precisely. For someone with limited mobility like her, the frequency and technique of repositioning need to be carefully considered.
Okay.
They might need assistance from a caregiver,
Right.
possibly even using a lift to avoid further injury.
Yeah.
And because of her weight, they'd pay extra attention to pressure points.
It's almost like a carefully choreographed dance,
That's a great analogy.
making sure they're supported and repositioned in a way that minimizes risk.
But repositioning is only one part of the puzzle.
Right.
There's also the use of specialized mattresses and cushions
Oh, yeah.
designed to redistribute pressure.
I've seen those. They look kind of like high-tech egg crates.
That's a good way to visualize them.
Yeah.
They help reduce pressure on those bony prominences,
Okay.
like hips, heels, and elbows,
Right.
which are most prone to ulcers.
Makes sense.
Yeah.
And then there's skincare,
Yes, skincare.
which sounds simple but is absolutely crucial.
Oh, definitely. Keeping the skin clean, dry, and moisturized is a big part of preventing breakdown.
I'm imagining they go beyond just a quick wash and lotion.
Oh, definitely. They're very particular about the products they use,
Okay.
favoring gentle pH-balanced cleansers and moisturizers that don't irritate the skin.
So it's about protecting that natural barrier.
Exactly. And no harsh soaps or lotions allowed.
Right.
Those can strip away the skin's natural oils
Yeah.
and make it more vulnerable.
What about managing incontinence? That seems like it would be a constant challenge in a nursing home setting.
It definitely is. Frequent changes of incontinence products are essential, of course,
Yeah.
but it also requires a high level of coordination and communication among the care team.
Right. Everyone needs to be on the same page
Yes.
to make sure the patient isn't sitting in moisture for extended periods.
Exactly. So it's a team effort, just like those carefully choreographed repositioning moves.
What else do they do to manage moisture?
Well, they often use barrier creams to protect the skin,
Okay.
and sometimes they even incorporate moisture-wicking fabrics into clothing and bedding
Oh, wow.
to help keep things dry.
I am seriously impressed by the level of thought and attention to detail that goes into each aspect of this care.
And we haven't even touched on nutrition yet,
Right.
which plays a huge role in wound healing and overall skin health.
Makes sense.
Remember our discussion about Frau Bessler possibly not getting up for meals?
Yeah.
Well, that's where the care team would step in to ensure she's receiving adequate nutrition.
So they're not just thinking about repositioning and skincare. They're looking at the whole picture,
Right.
making sure the patient is getting enough protein, calories, and essential nutrients to support healing.
Exactly. It's all about providing the body with the building blocks it needs to repair and regenerate tissue.
And if someone isn't eating enough, are nutritional supplements an option?
Absolutely.
Right.
And all of this, every intervention, every tiny detail is meticulously documented.
Documentation seems to be a cornerstone of German healthcare in general.
It is.
Is that something Schwester Eva talks about in her blog posts?
She does. And for good reason. For one thing, thorough documentation ensures continuity of care.
Oh.
Everyone involved in the patient's care can see exactly what's been done, what's planned, and how the patient is responding.
Right. So it's about accountability and transparency,
Exactly.
but also about making sure everyone is on the same page when it comes to the patient's care.
And because it's so detailed, the documentation helps track the patient's progress
Okay.
so they can see if the interventions are working. If a particular approach isn't effective, they can adjust the care plan accordingly.
It's like a constant cycle of assessment, planning, implementation, and evaluation.
You got it. And of course, this meticulous documentation serves a legal purpose as well.
Yeah, that makes sense.
It provides a record of the care that has been provided,
Right.
which can be important in case of any disputes.
It protects both the patient and the care providers.
Exactly. So we've talked about this incredible level of detail and proactive thinking.
Right.
But I have to ask, is all of this just driven by regulations, or is there something more to it?
That's a great question.
Mm.
While there are certainly regulations in place, I think it goes deeper than that. There's a genuine cultural respect for older adults in Germany.
Yes.
and a strong commitment to providing them with the highest quality of life possible.
It's not just about ticking boxes. It's about seeing the person behind the patient
Right.
and understanding their individual needs.
That's a beautiful sentiment. It's about combining that technical expertise with genuine human compassion. And speaking of expertise, I'm curious, what role does technology play in all of this? Are German nursing homes embracing the latest innovations in bedsore prevention?
That's a fascinating area to explore, and one we'll dive into right after this.
Welcome back to our deep dive into the world of German nursing homes and their approach to decubitus ulcer risk assessment.
Yes.
We've covered a lot of ground, from that critical 8-hour window to the SIS,
Right.
those incredibly detailed care plans,
Yeah.
and even touched on the role of technology.
It's been quite a journey.
It has.
And I think it's clear that German nursing homes are very systematic in their approach.
Okay.
But what's really impressed me is how that systematic approach doesn't overshadow the human element of care.
As we've been discussing all these technical aspects,
Yeah.
I keep thinking about the person on the receiving end of all this care.
Right.
Someone like Frau Bessler.
Yeah.
It can't be easy to suddenly find yourself in a nursing home facing a loss of independence and potentially dealing with a condition like a bedsore.
Absolutely. Imagine the emotional and psychological impact of that transition.
Oh, yeah.
You're leaving behind your familiar surroundings,
Right.
maybe struggling with physical limitations,
Yeah.
and now you're in this new environment reliant on others for your basic needs.
Yeah.
It can be a real blow to one's sense of self.
And if you add the discomfort and potential embarrassment of a bedsore on top of all that,
Right.
it's easy to see how someone's mental and emotional well-being could be seriously affected.
Yeah.
So how do German nursing homes address that side of things?
Well-
Is this something Schwester Eva touches on in her blog posts?
She does, and she emphasizes the importance of communication,
Okay.
which might sound obvious, but
Yeah.
it's especially crucial when you're working with older adults who may have cognitive decline or sensory impairments.
So it's not just about being clear and concise with your words.
Exactly. It's about taking the time to truly listen, validating their feelings, and establishing that sense of trust and rapport.
Right.
These are human beings who are going through a lot.
Yeah.
And simply feeling heard and understood can make a world of difference.
And when they feel heard, they're probably more likely to actively participate in their care
Exact.
and feel a sense of control over their situation.
It empowers them, which is so important for their overall well-being.
Right.
But communication is just one piece of the puzzle.
Okay.
Creating a sense of community is also essential.
Yeah, I can see how that would be vital.
Right.
If you're feeling isolated and lonely,
Yes.
it's going to be much harder to cope with the challenges of being in a nursing home.
Right.
So how do they foster that sense of community?
By encouraging social interaction among residents,
Okay.
organizing group activities, and really welcoming family involvement.
Gotcha.
The idea is to make the nursing home feel like a home,
Yeah,
not just a medical facility.
that makes a lot of sense. And it ties into what we've been saying about respecting individual preferences and routines.
Yeah.
Just because someone lives in a nursing home doesn't mean they have to give up all their autonomy.
If someone is used to waking up early and having their coffee at a specific time, the staff tries to accommodate that.
Yeah.
It's about those little things that show respect and preserve dignity.
It's about recognizing that each person is an individual
Exactly.
with their own unique history and preferences,
Yeah.
and that those things matter even in a nursing home setting.
Well said.
Yeah.
And while German nursing homes seem to be doing a lot of things right,
Yeah.
they also face challenges just like any healthcare system.
Right.
Staff shortages are a big concern.
Well, absolutely. You can have the best care plan in the world, but if you don't have enough skilled caregivers to implement it,
Right.
it's not going to be very effective.
Exactly. And that shortage can lead to burnout among staff,
Yeah.
which further impacts the quality of care.
Right.
It's a vicious cycle.
And then there's the issue of funding.
Mm-hmm.
I know here in the States, nursing homes are often underfunded, which can limit their ability to provide adequate staffing resources and training.
That's a global issue, unfortunately. But it's something we need to keep talking about and advocating for because everyone, regardless of age or health status, deserves quality care.
Well said.
Yeah.
So as we wrap up this deep dive, what's the one thing you want our listener to take away from all this? What's the most important message about the human element of care in German nursing homes?
I think the key takeaway is that it's about more than just procedures and protocols.
Yeah.
It's about recognizing the whole person, their physical needs, their emotional needs, their psychological needs, and creating an environment where they feel valued, respected, and supported.
It's about seeing the human being behind the medical chart.
Precisely. And when we focus on that human element, we're not just treating ulcers, we're caring for people.
That's a powerful reminder, and I think a perfect note to end on.
I agree.
It's been fascinating to explore this topic with you, and I'm sure our listener has gained some valuable insights into the world of German nursing homes and their approach to preventing bed sores.
Absolutely.
Until next time, keep learning, keep exploring, and keep diving deep into the complexities of the world around us.